So I'm Mia Geisinger. I am a periodontist, and I really want to talk about thinking about tooth extraction as an amputation. And when we think about it that way, everything that we can do to avoid that amputation is critically important. And the two main reasons that teeth are lost are due to caries and periodontal disease. And both of those diseases really relate to dysbiotic biofilm and oral hygiene. And so when we think about what we do, if we are not coaching our patients about oral hygiene, if we are not optimizing their oral home care, then we are doing ourselves a disservice. Everything we do, all of the beautiful restorations, all of the super tooth replacement strategies, all of the non-surgical and surgical therapy that we perform for patients, if we're not addressing their oral home care, we are not getting the best for those patients. If we see a patient twice a year for 2 times each for their prophylaxis appointment, hopefully that patient at home is brushing 2 minutes twice a day. That would be 30 hours of dental care that they're self-delivering versus those 2 hours that we're delivering in our chair. So we have to be confident that they know how to deliver that home care themselves. And when I think about what it means to be a doctor, the Latin root of the term doctor is really from the word docere docere, which means to teach. So our job as to coach is to teach our patients how to care for themselves when we are not present. The example I always use is if I go to a golf lesson and the golf pro swings a golf club and says, "Hey, that's how you do it," I'm going to feel like I wasted my $100 on that golf lesson, or $200, or however much it costs. So when I approach coaching my patients for home care, I really think about that, and I want to make sure that we have a way to deliver that in an environment that they were willing to accept the feedback, and we can make incremental coaching changes over time. A big thing that I do is I ask my patients to grade themselves. They usually give themselves an A for brushing, but nobody gives themselves an A for interdental cleaning. And the second a patient performs a self-assessment, they're far more willing to accept feedback on how to improve that over time. So my expert tip is making sure that we have optimized oral home care as an integral part of everything that we do in dentistry. And that is my expert tip.